Welcome to this video presentation of awareness on snoring, upper airway resistance syndromes and obstructive sleep apnea. This is a very commonly neglected condition, but it is a very dangerous condition as well, because most of the patients who come to the OPDs give that complaint in a very ignoring tone. That means they usually tend to ignore, I also have snoring. But snoring is a very important condition. It is a condition which is root cause for many other diseases in the body. In India, the number of people with overweight or obesity or morbid obesity are increasing in number day by day, and also simultaneously more amount of patients are detected to have diabetes mellitus at a younger age. If we come to the statistics of this snoring or obstructive sleep apnea, almost 40% of the male and 20% of the female population will experience this snoring at some point of the time. Complaints of snoring are more given by the person who is sleeping beside. It is not by the person who is actually snoring, because you are already asleep, you are snoring, so you don't get affected by this, but the person who is sleeping beside may get affected. And most of the couples turn up into the OPDs of sleep physicians, pulmonologists or ENTs, or if it is more, then they may end up in advocate cabins also. Now, what are the symptoms of this snoring or obstructive sleep apnea, and are all these things same? So primarily, to be very simple and clear, snoring is a condition where you make sound while sleeping, and this sound is produced by vibration of the pharyngeal walls. So whenever there is obstruction in the airway from the level of the nose to the posterior, that means back side of the palate, retropalatal area, back side of the tongue, retrolingual area, and the hypopharynx and the larynx, then we might end up in producing snoring. So whenever we have a simple snoring without any desaturation, that means the level of the oxygen saturation in the body is not falling, it is not hampering your sleep habit, it is a simple snoring. But whenever you have excessive resistance of the upper airways for this respiration, and it tend to make you awake, it chokes you, then you will get up gasping, then you take quick breaths, deep breaths, and then again go back to sleep, then probably you have upper respiratory resistance syndrome. Then comes the obstructive sleep apnea. The diagnosis of this obstructive sleep apnea is through polysomnography or a sleep study. So what is sleep study? I'll tell you later. Now, in obstructive sleep apnea, you may throw some symptoms like excessive daytime sleepiness. That means whenever you are working, may it be a clerical work, you are a driver by occupation, you are in a field, or whatever it may be, or you get even small time to sit back, you will try to doze off, you will snore even in daytime. So this is excessive daytime sleepiness. Then you slowly will start having memory loss, then neurocognitive disorders, like you will have difficulty in focusing on a small thing, concentration difficulties, these things will be there. And what happens lately is it will affect multiple systems of the body. We are opening mouth and snoring, so primarily we are taking this respiration through mouth. The mouth will go dry. This will lead to recurrent sore throats, infections, because now what lately happens is multiple times your sleep is being disturbed. Some people will have difficulty in initiating sleep also. Some people have insomnia. So these people will have disturbed sleep, and in the daytime they tend to be more confused, then more delirious, increased weight gain, and then insulin resistance also. So they probably will have diabetes mellitus in future. Then it affects the cardiovascular system as well, because your body requires oxygen, and your lungs and heart will take that oxygen no matter what happens to your body. So whenever there is obstruction in the upper airways, your lungs are trying to pull that amount of air against that more increased resistance. So the right side of the heart, which is pumping to the lung, it will pump with more force. And then there is something known as pulmonary hypertension. Then it will lead to right heart failure and many things. It means your lipid levels may go high. Then you may have metabolic syndrome or syndrome X, where your lipids, your fats, your carbohydrates, everything are getting deranged. So these are the complications if you remain untreated for your obstructive sleep apnea. Now, now you are convinced that okay, you have snoring, you should get evaluated. Now, most of the times you will be knowing what level of obstruction you have or where the obstruction exactly is. So it might be at the level of the nose, it might be at the level of the tonsil area, it might be at the level of the back of the tongue. So in order to have a proper evaluation, you can go to an ENT surgeon, you can go to a head and neck surgeon, you go to a pulmonologist also. In order to identify what is the amount of obstruction you have, we usually get one polysomnography done. So in that it will tell you for what brief amount of time you did not take respiration, decreased saturation in the body, which is known as apnea, hypopnea. Then depending on multiple parameters that this PSG report gives, we will try to categorize you into if you are a mild OSA, if you have moderate OSA or a severe OSA. Primarily we have to understand that this is because of decreased caliber of the airway. That means initially the airway, if it was this big, now it has become small, and then you are throwing these symptoms and signs of obstructive sleep apnea. Way in which we can decrease this obstructive sleep apnea is weight loss, which everybody hates. I mean, hates in the sense people might have tried it in multiple ways, but it is very difficult to, because we usually try for shortcuts. We usually put a period of like in 2 months I have to reduce 10 kgs, in 3 months I have to reduce 20 kgs and all. So the problem is you have set a goal, and once you reach it, again you get relaxed, then again you put on weight. Weight loss should be ingrained into your daily routine activities by changing little habits. That means your eating food habits, you try to cut down the junk food, you try to cut down the calories of your normal meal. Rather than taking a bike or a car, you can go bicycles or you can go on foot. So there are small things which you can change to your lifestyle that will decrease your weight. Second thing, drugs. Coming to drugs, what are the medications that will decrease snoring? Unfortunately, there is no drug that will decrease your snoring. Second thing is CPAP. CPAP is like, we will continuously put you on positive airway pressures. There is a machine and it is attached to your nose, and it will pump positive air all the time. So in that condition, most of the times the snoring will come down, you will have a better sleep, but the compliance is very problematic. Having that for life together, like every day you have to use that, is not acceptable by many of the patients. Now the rest one which is left is surgical intervention, DISE, which is known as drug induced sleep endoscopy. Before doing your surgery, we will try to put a small endoscope through your nose and see at what level there is obstruction, and depending on that we might change the surgical plan on table also. So 50% of the times we might change the surgical plan on table. Initially at the level of the nose, if the obstruction is expected or if it is detected, then we do septoplasty, then turbinate trimming. The second one is at the level of the palate. Almost 100% of the patients who come with severe snoring will have this problem, that obstruction at the level of the palate. That means you see that small uvula or a small tongue, which is usually known as, that will fall off back whenever you are asleep, and that will cause more amount of obstruction. So at the level of this, or whenever your tongue is bulky, then it will fall back and then it will cause obstruction. Also there are multiple procedures that are done to the palate, like Z-plasty, then we have radio frequency ablations of the palate, and also treatment at the level of the base of the tongue, whenever it is bulky, whenever there is lingual hypertrophy, there are multiple things to it. Just I am telling you these medical conditions that you should know that surgical correction of this obstructive sleep apnea is not a one-time surgery. We might have to take multiple stages of surgery, because after every surgery where we will address the most obstructing part, we will try to see if you are benefited out of any surgical procedure, of this surgical procedure. Snoring is also seen in children. So most of the times, almost 99 to 100% of the times, children snore because of adenoids, that is a mass which is present behind the nose, and also tonsils. So a simple adenotonsillectomy most of the time should do in children, until unless they have some syndromic or malformed faces. Are these surgeries foolproof? No. Even after having multiple surgeries, you might have to use CPAP machines. Now, if you ask me what is that procedure with which we will not have any kind of snoring, we want a permanent solution, then the permanent solution will be a tracheostomy. Tracheostomy is a procedure where we will make a small hole in your anterior, that means front part of your neck, and we'll put a tube directly into the trachea, circumventing all this obstruction. But then it is not recommended, it is not also acceptable by the patient. So to understand from this video of obstructive sleep apnea awareness is, obstructive sleep apnea is not a simple condition, it is a symptom, it is a disease, and it should be medically attended. Then you have treatment in the form of lifestyle modifications. Then ultimately you have some surgical procedures where almost 70 to 90% of the patients will gain some amount of relief from the obstruction. You can have a normal social life, and also you can prevent major morbid complications from happening. It is very crisp, it is very clear that obstructive sleep apnea is a disease which needs medical attention, which needs treatment. Thanks.